that's where a good fit and comfort become really important as far as educating them from the ground up. And then I also talk to them about how to check their feet and the conditions that I would look for, things like numbness or tingling starting to develop, and those are the what's called peripheral neuropathy. The thing that sometimes we'll see with people being really scared is they assume that if they've been diagnosed with diabetes, it means they're eventually going to have an amputation. Last study I looked at, I think, showed less than 10 to 15% of people with diabetes end up having an amputation, so it's a small number, relatively speaking. And again, the ones that I see getting in trouble are the ones that kind of neglect things. I've even had patients where last year I said, okay, you have numbness in your feet and you have a really bad contracture of your toe that gets rubbed by your shoe. That will be the most likely place for you to develop a sore or ulcer. So whenever you see a sore or redness, you come in and see me. They'll come back in a year later, they've got a big red swollen sore that's draining pus. And they'll be like, yeah, it was hurting, or actually it didn't hurt, so they have neuropathy. It didn't cause any pain, but they'll say, yeah, it's been red and draining for, I don't know, a month or two now. And it's kind of like, really? We were pretty clear, we talked about this, that this would be an area that could be a problem. And those are the kind of people that will end up having an amputation, or sometimes if we're lucky, we can save it just by draining the infection and putting them on antibiotic. So not to get kind of grosser, but that's one of the darker sides of what can happen with diabetes. But fortunately, yeah.
What would you recommend when that patient comes into our store in that condition?
Yeah.
And sometimes, or a little bit less, it's a little uncomfortable to tell them, I don't know, is there a medical word that we can use, or to say that we'd rather them not try on shoes, or how we do that? Because
it's a good question. It does put you guys in a tough spot, right? Because you're not going to diagnose someone with an ulcer on the spot. But I would say, to be safe and to maybe even score some points with the medical community, anytime someone's complaining about foot pain, or you see they have a red spot or a sore on their foot, especially if it's red and tender, tell them that it'd be a good idea for them to see a doctor before they get a new shoe. Okay, and that's just the safest thing for you guys to do. And I'm sure most of you have probably been in a situation like that where you're like, I don't know if I should be helping them with shoes right now. I think they have a bigger issue going on. So it can be delicate. Some people might be insulted. Some people might be really thankful. Others might kind of fall in between. Especially if they've told you they have diabetes, then especially say let's err on the cautious side and have you see your doctor first. But I think that's an important question, and it's kind of a delicate area too, right? And we'll talk a little bit more about that too as we get into some of the fitting part. Any other questions along those lines or related to that? Okay. You guys have a couple more. All right. So if you look at what do we want to talk to about when it comes to foot health with our diabetic patients, what I have them get in the habit of doing is maintaining good foot hygiene, like we talked about earlier. So just keeping your feet clean and doing simple things to make sure the skin's healthy and moist, not ignoring calluses, not ignoring nail problems. I think one of the benefits of maintaining good foot hygiene is it actually forces our patients to look at their feet and touch their feet every day, which is a good way to make sure they're not overlooking something, especially if they have started to develop some neuropathy. The other thing that I'll tell them is the number one risk, or the most important time where they may develop a sore or an ulcer, is when they get a new shoe. So that's where this comes in, right? And that makes sense, right? I mean, plenty of us have had new shoes that we got a little sore from, maybe a little blister from early on, and never had a problem again. But if you think about, if you had less than perfect sensation in your feet, you could easily develop a full-blown sore, a full-blown ulcer, and not even know it. So not only do I emphasize that they need to maintain good foot hygiene, but whenever they buy a new shoe, they have to be very cautious when they break it in, an hour the first day, 2 hours the second. I'm not always hardcore about going by the clock, but at least making sure at regular intervals they take the shoe off, they look at their foot, or have someone else look at their foot. So I think that's an easy thing to tell people with diabetes, is that just that. It's the most common cause of a sore or blister is a new shoe. And that doesn't disparage shoes at all. I think most people are aware that they have to be cautious as they make that transition, but it's tricky if you can't actually feel it. The other most common area to develop sores or ulcers for diabetics is on the forefoot. So it's usually going to be either near a bony prominence or by especially the big toe and the first metatarsal phalangeal joint. Those are far and away the most common sites that we see ulcerations on the foot. I'll talk a little bit about neuropathy. So neuropathy or peripheral neuropathy, sometimes called diabetic neuropathy, that is a term that means numbness. In early stages of it, patients will talk about they have kind of a tingling, burning, numb, or electrical sensation. A lot of people will say they only notice it at night and that they feel normal during the day. And that's very common. And the thought on that is that these neurologic changes that could occur with diabetes occur very slowly and very gradually. So when it comes to our sensory system, if there's a real subtle change in sensitivity or touch, you may not notice it during the day because you have a lot of stimuli going on. You have sounds, you have visual, you have sensory or touch sensation going on, so you don't notice really subtle changes. But at night, when everything kind of calms down and your body calms down, a lot of patients will say they kind of become aware of some tingling, some burning, some strange sensations. Some people describe it as creepy crawly or feeling like they have little bugs crawling on them. So that's an early sign of peripheral neuropathy. Most people seem to develop it in their feet first. In severe cases, it will come to their hands too. Sometimes, not to go off topic, but sometimes you'll see it with people that have had chemotherapy, they get peripheral neuropathy too. And 30% of our older patients that don't have diabetes get neuropathy as well. We don't know why they get it. In fact, we just say it's, a lot of times we just call it age-related nerve changes. So some people can have neuropathy just because of part of the aging process. I think one good lecture we'll do down the line is just how to fit the older patient too, because that's a topic there. But so when it comes to that neuropathy, it's hard to quantify. There's 3 different things I use in clinic to assess it. You can assess their vibratory threshold. You just use a tuning fork. It sounds funny, but there's different types of nerve sensors that we have in our feet, and some of them are more sensitive to the vibration. We know that with neuropathy, they tend to lose vibratory sensation first, so it's a good clue. There's also a monofilament that we use to test. And it's basically like a little fishing line you press against the skin. If they can't feel it, we know that they've lost what's called protective threshold sensation, and I'll give you more details on that. And the other thing that we check is their deep tendon reflexes. When it comes to this concept of protective threshold sensation, what it means is that if someone can't sense the vibratory sensation or the monofilament, it means that they probably wouldn't be able to feel like a blister starting. They wouldn't be able to feel maybe a pebble in their shoe. So they've lost what's called protective threshold. Once they've lost that, then that's where our CPEDs are well aware. That's when we know that we need to go to a higher level of protection for them, because then they actually would qualify for a custom insole and an extra depth shoe. Obviously, we're not quantifying people for that in the store, but it's kind of an important distinction. A lot of people have neuropathy, and a certain segment of them will have lost protective threshold sensation. And obviously the importance there is, you know, I've even had some patients say, well, my feet don't hurt. I kind of like them being numb. But honestly, you know, pain, there was a book I had seen called Pain is a Gift, and it does make sense. I mean, if you're not aware that you have an impending injury, that's not a good thing. And you'd be surprised. I mean, in clinic, I've seen people with needles in their feet, tacks in their feet, had no clue. In fact, one of my patients, he came into clinic, and he was a nice guy. He was really careful with his feet, but he came in, he said, yeah, I was standing in the shower, and I heard this clicking underneath my foot. And he goes, I was barefoot, so I thought, that's not normal. So he couldn't even look at his foot. He was a bigger guy, so he came into clinic, and yeah, he had a tack sticking out of his foot. Didn't even know it was there. Yeah, and luckily, he was smart enough to say, that doesn't sound right, and came in. He didn't wait for it to get bad. But it's pretty profound. I still remember that because I was a resident at the time. I thought, wow, that's shocking that he could not even feel this. Most people would be falling all over themselves to get that thing out. So, so it can be pretty profound. The other things that we'll see are skin changes. So a combination of aging, being overweight, but also having diabetes, less than perfect blood flow. When you have less than perfect blood flow, it doesn't just mean that you don't have great blood flow to your muscles and tendons, but skin can atrophy. And you guys have seen this. You know, the skin